Hello, my name is Carmel Facer and I am a lung cancer nurse specialist. This video is aimed at those just finishing or on long-term lung cancer treatment and contains some advice and guidance to support your well-being. Short-term side effects can be sometimes difficult to manage, and there are some steps you can take to help manage them. Breathlessness can be a common side effect, and simply breathing in slowly through your nose and out through your mouth can help. Alternatively, you may see a physiotherapist who can teach you some simple breathing exercises. Making daily activities easier when experiencing breathlessness can help. For example, using a trolley when you go shopping, or keeping things you often need downstairs so you do not need to regularly walk up and down the stairs. Using a fan to direct cool air towards your face, eating smaller and more frequent meals and taking smaller mouthfuls. If measures like these are not enough to control your breathlessness, you may need further treatment. There are medicines that can help improve breathlessness, and speaking to your nurse specialist or your GP is a good step to take if you would like to explore these medications. Home oxygen therapy can be an option in severe cases, however this needs a prescription and can be accessed via your GP. If breathlessness is caused by another condition, such as a chest infection or build-up of fluid around your lungs, treating this may help your breathing. So look for any discoloration in your phlegm and mention it to your lung nurse specialist or GP. Some people with lung cancer have pain while others never have any. Pain is another common side effect which varies from person to person. What causes cancer pain is not very well understood, but there are ways of treating it so the pain can be controlled. It's important that you let your lung nurse specialist or GP know if you have any unmanaged pain, and then they can help prescribe some medication to help with this symptom. If it isn't working, then they can review the medication you are on. Long-term side effects can also have a real impact on your daily life, and there are some steps you can take to help manage them. Even if you already have a healthy lifestyle, you may choose to make some positive lifestyle changes after treatment. Making small changes such as giving up smoking, eating well and keeping active can improve your health and well-being and help your body recover after treatment. Red flag symptoms are changes to your well-being that you may notice, and we would like you to be aware of what these look like and feel like. These are sudden changes to your breathlessness, sudden onset of pain in your lungs or chest, coughing up bright red blood. If you think you have any red flag symptoms, it is important that you take action. So please do call your lung clinical nurse specialist and let them know. Mention when the symptoms started and how regularly you are noticing it. If you leave a message and no one calls you back, then call again. It's very important you let the team know if you notice any of the highlighted red flag symptoms. If in doubt about anything when recovering from cancer treatment, it's important to reach out to your lung nurse specialist or GP for advice.
I'm Graham, and I was diagnosed with stage 4 lung cancer in January 2019. I was told that I'd probably got 6 months to live. Once they'd done all the tests and I got into the immunotherapy, I improved very quickly, so quickly I began to think I'm going to be around a lot longer than 6 months. And here I am at the time of talking to you, 3.5 years later. I was warned about a whole series of side effects, like my gums may bleed. And I was quite fortunate in the sense that I didn't have most of these. The only real problem that I had, food that I'd always enjoyed, tasted awful. One of the most important things to me was discovering the use of tinned fruit. My brother, who'd had cancer and lives in California, had actually recommended this to me. It's certainly something that helped me. Your mouth does tend to dry up a lot In fact, to be honest, it's even drying up talking to you in conversation now. And in my jacket over there, I've got a little bottle of water, and I carry that around with me just in case my mouth starts going dry. I also like trying to keep fit. I bought myself a rowing machine because it is important to keep yourself reasonably fit, and always to try and look positively. I know people talk about sort of trying to beat cancer as if it's a battle sort of thing, but you do have to have the outlook that, you know, I can do something about this.